Welcome to the Housing Stabilization Services Remote Regional Roadshow for Providers. My name is Jensina Rosen, Housing Policy Consultant with the Minnesota Department of Human Services, Housing and Support Services Division. Thank you for making time to attend and view our roadshow. We originally planned to visit each region in person, but needed to switch to virtual sessions due to COVID-19. We offered 5 regional roadshows for our partners across the state. This recording occurred outside of live regional roadshows. Today, we will be going over the following agenda items: a high-level overview of housing stabilization services, provider training updates, individual enrollment process, provider enrollment and billing, managed care organizations, impact to housing support, some important reminders and additional resources, and we will not be doing question and answer today. In addition to myself, Becca Koffenberg-Statry and Mark Caldwell with the Housing Stabilization Services team will also present roadshow material. I will now turn it over to Becca to provide a high-level overview of housing stabilization services.
Hi, hopefully by now you have all heard about the new Medicaid Housing Stabilization Services benefit that launched on July 20th of 2020. We are excited to be able to address the health of our Medicaid recipients by offering this service to stabilize people's housing. For this presentation, we will be covering a high-level overview of these services. For more details on the services, please check out our policy webpage, which has detailed policy information and a PowerPoint from December of 2019 that goes into more specific details about the services themselves. Important news: housing stabilization services are now available for individual enrollment as of July 20th of 2020. Due to the impacts of COVID-19 on the Housing Stabilization Services Eligibility Review System development, claims and billing start date, so the dates that providers can bill for services, is expected to be August 24th of 2020. Equally important to know is that this is a rolling implementation. If a provider needs time to make an informed decision as to enroll, that's completely okay. There is no deadline for enrollment. The goals of the services are to support an individual's transition to housing, increase long-term stability in housing, avoid future periods of homelessness or institutionalization. The 2 primary services in housing stabilization services are transition, which helps people plan for, find, and move into housing, and sustaining, supports a person to maintain living in their home. These services are not sequential. A person doesn't need to have used transition services to access sustaining services. If a person needs support to maintain their current housing, they can access sustaining services first. There is also a third component, housing consultation. Housing consultation is a new planning service available through Housing Stabilization Services that provides a person-centered plan for people without Medicaid-funded case management. To be eligible for services, an individual needs to be on medical assistance and be aged 18 or older. Beyond this, there are 3 basic eligibility criteria. They must have a disability or disabling condition, be experiencing housing instability, and have a need for services due to limitations caused by their disability. We'll go into more information on each of these components in the next slide. Housing Stabilization Services uses the expanded definition of disabling condition as established by the Department of Human Services Housing Support Guidelines. A person does not need to be certified disabled in order to access these services. So a disability or disabling condition means the person is aged, blind, or disabled as described under Title II of the Social Security Act, so be a recipient of SSI or SSDI, or could be a person determined by a medical profession to have any of the following conditions: a long-term injury or illness, a mental illness, a developmental disability, a learning disability, or substance use disorder. Proof of disability can be shown through a professional statement of need, a medical opinion form, proof of receipt of SSI or SSDI, or other forms of disability documentation to be determined, primarily to be 65 or older, or to be eligible for MA through MABX or MADX. Note that in June of 2020, the Department of Human Services released an updated professional statement of need. The professional statement of need now includes eligibility criteria for housing stabilization services, but we do want to point out that a county designee who can sign for housing support cannot complete the professional statement of need for housing stabilization purposes, unless that county designee is also a qualified professional, as determined through for the professional statement of need. The next part that a person must meet is they must be experiencing housing instability. So that means they must meet Minnesota's definition for homelessness, which is a broader definition for homelessness and means that a person does not have an adequate nighttime residence. The person may be at risk of homelessness, and this occurs when the person or family is faced with a situation or set of circumstances likely to cause the household to become homeless, including but not limited to living doubled up, arrangements where the individual's name is not on the lease, living in a condemned building without a place to move, having arrears in rent, utility, or payments, receiving an eviction notice without a place to move, and or living in temporary or transitional housing that carries time limits. If the person was previously homeless, also falls into at risk of homelessness, or if they will be discharged from a correctional, medical, mental health, or substance use disorder treatment center, and they lack sufficient resources to pay for housing, and they do not have a permanent place to live. Another piece that falls under at risk of homelessness is if people will become homeless if they don't retain their housing services. Another housing instability criteria is currently transitioning or have recently transitioned from an institution or licensed or registered setting, or if the person is eligible for waivered services. Housing instability can be documented by the professional statement of need or through a MCOs or long-term care consultation. And those are for people who need long-term services and support. If people are already accessing that pathway, MCOs also assesses for housing instability, or coordinated entry assessment. And this is the assessment for people who are currently experiencing homelessness. In addition to having a disabling condition and housing instability, a person must be assessed to need assistance due to their disability in one of the following areas. They must need support with communication, mobility, decision-making, or managing challenging behaviors. Assessed need will be captured in each of the 3 assessment pathways. Once again, the professional statement of need, MCOs or the LTCC, or the coordinated entry assessment. It is important to note that the professional statement of need is the primary pathway onto the services because it captures all 3 needs-based criteria: disability, housing instability, and assessed need for services. So that one document covers all 3 components required for our services. Housing stabilization services are home and community-based services and must meet all CMS home and community-based requirements. One of these requirements is that a person must have a person-centered plan. That person-centered process must be driven by the individual, include the person's strengths, interests, wants, as well as what supports they need, and help the person make an informed choice about their housing stabilization provider. The responsibility of who does the person-centered plan depends on the professionals involved in the person's life. If a person already has an MA-funded waiver case manager, that person will complete the update the coordinated services and supports plan or the coordinated care plan to include housing stabilization services. If a person has a targeted case manager, the targeted case manager completes a housing-focused person-centered plan. If a person does not have a targeted case manager or a waiver case manager or senior care coordinator, Then the person needs to find an enrolled housing consultant in the area to complete this requirement. We recently published the Housing Focused Person-Centered Plan that targeted case managers and housing consultants will use, and it is available for review through the Department of Human Services eDoc page. In summary, this is a visual of the process an eligible person takes to enroll in housing stabilization services, from assessment to eligibility review, which is what we will cover in the next section. So this slide shows a person, and that's the eligible person. And then there are 4 boxes. And in the first box, it discusses it says assessment, and it talks that the assessments are the professional statement of need, a MIN choices or long-term care consultation assessment, or coordinated entry. The second box says plan. A housing-focused person-centered plan can be completed by the housing consultant or targeted case manager. Community services and supports plan will be completed by the waiver case manager, or a coordinated care plan, which will be completed by a senior care coordinator. The third box explains that the housing stabilization services provider will submit the assessment, the plan, and the documentation of disability or disabling condition. The fourth box says eligibility review. The provider is notified through minutes that they can begin working with the person. I will now turn it over to Mark Caldwell to review training updates and the individual enrollment process.
Thanks, Becca. This is Mark Caldwell, and I'll be now talking about provider training updates and the individual enrollment process. The training for housing consultant and transition sustaining providers is now available on TrainLink. There are approximately 13 modules for the transition and sustaining provider and approximately 5 modules for the housing consultant training. The training is in the Housing and Support Services Learning Center. In order to complete the training, every staff member will need a unique key that is generated through TrainLink. It's free and easy to get. Staff will need to go through all the training modules in order to get a certificate of completion. This may take 2 to 3 sessions to complete. Once staff have completed the training, certificates will need to be held by the Organization for Monitoring Purposes by DHS. Employees can also access certificates from the Learning Center, and if they move to a new employer, they won't need to retake the training. In order to provide housing stabilization services, a person must be first found eligible for the program. Form entry and submission occurs through an interactive eDoc that, once submitted, will go directly to the eligibility review staff. Eligibility documents are all uploaded via this eDoc, which is called Housing Stabilization Eligibility Request Form, DHS-7948. Please visit DHS eDocs library to search for this form. Once you've entered the form, you'll need to submit a reason for your request. There are 6 different reasons a provider can submit an eligibility review request form. We will go over the initial eligibility request together here and then provide a brief description of the other types of forms. Make sure you've completed all of the documentation needed in order to submit this request. You will see in the visual that there are various boxes that you need to submit information for. The top box says recipient information, then consultant is the second box. The third box is housing provider. The fourth box is attachments, and the final box is submitter. We will review each box and discuss what is required for them. The recipient information section requires housing status, housing instability, disability type, PMI number, which is the Person Master Index, and note that a PMI number is required and it can be located in minutes or in other documentation that the person may provide to you. Additionally, you will need their date of birth, their living situation, and their address, which includes city, state, zip, and county or tribal location. Next, you will move on to the consultant box. If you are the housing consultant, you will click yes. If a plan was developed by a waiver or targeted case manager or a care coordinator, you will click No. If you click Yes, you will need to provide this additional information: agency name, NPI or UMPI, contact first and last name, zip code, county or tribal location, phone number, and email address. If you're a housing consultant, you'll need to input the transition sustaining provider's information as listed in the Housing Focused Person-Centered Plan. The Housing Transition Sustaining Provider information section requires name, city, zip code, and county or tribal location, as well as a contact phone number. The Attachments section requires that you submit supporting eligibility documentation. The 3 areas you'll need to attach documents are proof of disability type, assessment type, person-centered plan type. Note, only PDF, Word, Excel, JPEG, GIF, PNG, bitmap, and text files may be uploaded as attachments. Make sure you've looked over all of the documents you want to attach to verify that they are accurate and up to date. Here is a list of all documents that you could attach to show someone's proof of disability: professional statement of need, state medical review team, MADX or MABX. In this case, you do not need to attach anything if you select this option, because the DHS Eligibility Review staff will check this in the review process. Social Security income or Social Security disability insurance. For proof of disability for these 2, you could include a check stub or deposit verification as long as the date is within 90 days of form submission, an award letter, or the benefits lookup worksheet from HB 101 or DB 101. Additionally, you can provide a medical opinion form or age 65 or over to indicate proof of someone's disability. Here's a list of the assessment types you could attach to show someone's proof of housing instability and assess need. Professional statement of need also meets proof of disability. Coordinated entry, Min-Choice's assessment or long-term care consultation, LTCC. And if you are a housing consultant and you select this option, you will submit the Community Support Plan Worksheet, DHS-6791A. If a person has a waiver case manager and you select this option, you won't need to submit an attachment. There are 2 options to choose from for the person-centered plan type. Housing focused. This will be selected if you're a housing consultant or if someone has a targeted case manager. The other option is the coordinated services and supports plan. You will select this if someone has a waiver or case manager or senior care coordinator. And there's an important note: if someone has a senior care coordinator, when asked for the attachment, you will submit a coordinated care plan under the coordinated services and supports plan option. The submitter information requires that you submit the submitter's first name and then the submitter's last name. It's important to note that senior care coordinators, waiver case managers, or targeted case managers will never submit this form. The transition sustaining provider submits it with the plan created or updated by the care coordinator or case manager. All eligibility request forms will be processed as soon as possible and in the order received. DHS staff will review documents and then notify the provider if the person's application has been approved or denied. If denied, a notification will be sent to providers and the person with comments as to why the request was denied. Approval notifications will be sent via the minutes mailbox to providers and to a person through the mail. If a person has been approved, the provider may begin working with them and start billing for service. The housing consultant is able to bill for the person-centered planning session once the person is determined eligible by DHS for the service. In addition to the initial eligibility request form, the online system includes 5 additional forms that may be submitted: a renewal eligibility request, Submit this type of request when a person needs to have their services renewed, which occurs on an annual basis. There's a PC plan request. So you submit this request when a person has their person-centered plan updated. A provider change request. Submit this request when a person selects a new provider. An additional transition sustaining unit request. So submit when a person would benefit from additional units due to at least 2 barriers. This concludes the training and individual enrollment section of the presentation. I will now turn it over to Jensina Rosen, who will walk you through a high-level overview of the provider enrollment process.
Thanks, Mark. This is Jensina, and I will be walking through the provider enrollment process. Just some important highlights to consider when enrolling with Minnesota healthcare programs for housing stabilization services. You can find enrollment information by visiting the DHS website and finding the Partners and Providers tab located at the top of the page, and then navigate to Policies and Procedures. Once in Policies and Procedures, you can click on the MHCP Provider Manual, which brings you to a comprehensive manual covering all Minnesota healthcare programs, as well as a link to provider billing and enrollment. Specific requirements for housing stabilization services providers include being knowledgeable of local housing resources, passing a criminal background check, completing mandated reporter training, and consultation providers must complete housing consultation training, which is available on TrainLink. Transition and sustaining providers must also complete the mandated housing transition and housing sustaining training available on TrainLink. There is an application fee to enroll in services. The application fee must be paid before applying to Minnesota healthcare programs. Providers will need to pay the application fee or attach proof that you have paid the fee to either Medicare or another state. Pay the fee online through the Minnesota Healthcare Programs Provider Screening Collection System. And the address on the payment must be the same as the address being enrolled. So when is the application fee required? If you are a brand new provider, never been enrolled with MHCP, and you're using an employer identification number, the application fee is required. Additionally, if you are an existing home and community-based services provider and or housing support provider, but you do not have a housing access coordination enrollment record, then an application fee would be required as well. Please note that housing stabilization providers with controlled or owned locations where they will be providing housing sustaining services must enroll each location separately. So when is the application fee not required? It is not required if you are a brand new provider, never been enrolled with MHCP, and you're using your Social Security number for your business. It is also not required if the provider is currently enrolled with MHCP and has an active Housing Access Coordination enrollment record. There are a variety of required MHCP enrollment forms through the enrollment process. So the first is Housing Stabilization Services Provider Enrollment Application. The next is MHCP Provider Agreement Form. The third is Disclosure of Ownership and Control of an Interest of an Entity. The fourth is Home and Community-Based Settings Applicant Assurance Statement. The fifth addresses applicable assurance statements to the services you plan to provide. So you may submit one or both depending on your enrollment, which includes the Housing Consultation Provider's Applicant Assurance Statement or the Housing Transition and Housing Sustaining Applicant Assurance Statement. There's also a request for licensing agency ID number form, an EFT vendor number notification, and then also you are to review and keep a copy of the MHCP data privacy notice. If you are an existing housing access coordination service provider, there are additional forms you will need to complete to add housing stabilization services to your record. So the first is the Home and Community-Based Settings Applicant Assurance Statement, and then the applicable assurance statements to the services you plan to provide. So that would be for housing consultation providers, their applicant assurance statement, and the housing transition and housing sustaining applicant assurance statement. So what does the processing timeline look like? Whether submitted using MPSC portal or fax, applications are processed in the date order received. Please allow 30 days for processing. If MHCP requires more information, you'll receive a request for more information letter, or an RFMI. Each RFMI is considered a new request and is subject to the same processing timeline, or 30 days. So to enroll with MHCP, you would enroll online using the Minnesota Provider Screening and Enrollment Portal, or MPSE, or you can fax completed forms to 651-431-7493. There are additional resources that you can find online through the Provider Manual, which includes more details in the Provider Manual with regards to enrollment, Housing Stabilization Services enrollment criteria and forms, MHCP provider screening requirements, the Minnesota Provider Screening and Enrollment Manual, and you're also encouraged to contact the Minnesota Healthcare Programs Provider Call Center at 651-431-2700 or 1-800-366-5411. And finally, the Provider Relations Unit has scheduled training webinars which covers policies, procedures, and the minutes billing systems through the end of 2020. This training is provided for fee-for-service providers who offer services to Minnesota Healthcare Program members. Please visit the MHCP Enrolled Provider Training webpage for upcoming courses, conferences, webinars, and training. I will now turn it over to Becca, who will talk about working with managed care organizations.
Thanks, Jensina. So working with managed care organizations, this is going to just be some very high-level information, primarily offering links to resources, but I will give you a little bit of information. Most people eligible for Minnesota healthcare programs are enrolled in managed care. We anticipate around 80% of people served on housing stabilization services will utilize a managed care organization for their health care or be on a health plan. DHS currently contracts with these 8 managed care organizations: Blue Plus, Health Partners, Hennepin Health, Itasca Medical Care, Medica, Prime West, South Country Health Alliance, and UCare. MCOs have contracts with DHS to provide healthcare services to 3 specific populations: Minnesota Children's and Families, which provides support for parents and caretakers of dependent children, pregnant women, low-income adults without a dependent child. This group is sometimes called PMAP. Minnesota Senior Health Options and Minnesota Senior Care Plus provide services for clients aged 65 and over who have medical assistance and Medicare Parts A and B. The last group is those for special needs basic care, and this is a voluntary managed care program that covers health care for people with disabilities who are aged 18 through 64, have medical assistance and Medicare Parts A and B. For providers to enroll with MCOs for housing stabilization services, they should first enroll with the Minnesota Healthcare Programs, which is what Jensina just talked us through. Then they should contact each MCO to complete any paperwork required to be enrolled for housing stabilization services with that MCO. Providers will bill each person's MCO for their services, and it's important providers check each month to ensure the person has the same MCO. If not, the provider should reach out and contact the new MCO for that person so that they can bill the new MCO for the services provided. These next 3 slides are resources to help get you in touch with MCOs in your area. These are the links for the 7 MCOs that require paperwork for housing stabilization services. As of writing this, all MCOs have agreed to use the DHS network of enrolled housing stabilization services providers. In order to work with an MCO, providers will need to complete enrollment paperwork with the MCOs in the area. Some MCOs require minimal paperwork, like a 1 to 2 page agreement, in order to enroll and bill them for services. This page and the following page identify each MCO and the contact information of the MCO representative responsible for housing stabilization services. So the last slide in our MCO section is another resource and contact page. We have the link for the DHS MCO Customer Member Services Information webpage, as well as a link to the provider portal and a link to the provider registration. The DHS contact for our managed care contract manager is Mike Flicker, and he is happy for you to contact him with any questions that you may have regarding working with MCOs and housing stabilization services. I will now turn it over to Mark Caldwell, who will talk about the impact of housing stabilization services and housing support.
Thanks, Becca. So I'm going to talk about the impact to the housing support program. In 2017, legislation for Minnesota to pursue MA housing services, and there was duplication with supplemental services estimated at 50%, but not 100% for people in community-based settings. There is going to be a reduction of supplemental service rates by 50%, scheduled for July 2021, only for these categories: long-term homeless supportive housing, metro demo, and housing with services independent living and not assisted living. The reduction is not dependent on provider enrollment in MA services. There will be limited duplication between supplemental service rates and housing stabilization services. For example, tenancy supports are clearly overlapping with housing stabilization services. The supplemental service rate and housing stabilization services could also overlap with basic supportive services. Housing support pays for some services that housing stabilization doesn't, such as employment, health supervision, and other areas. Things that won't change for housing support: room and board rates, billing in minutes for supplemental services, service standards related to the professional statement of need, and documentation. While case notes are still required, it's okay to track in the same system as long as activities can be reported separately, and there is no electronic health record requirement. So what should housing support providers do? They should identify which housing stabilization service is a good fit and if they want as an agency to provide it. They should enroll to become a housing stabilization services provider. They should use the time to develop processes before the rates change. They should develop partnerships for assessments, person-centered plans, and billing, and get technical assistance if needed. I will now turn it over to Jensina to cover some important reminders about housing stabilization services, additional resources, and planning tips before we end the presentation.
Thanks, Mark. Moving on to some important reminders about the service is that housing stabilization services duplicates housing access coordination in the 1915C waivers. These will be removed from waivers and recipients will access services through the state plan. People will transition onto housing stabilization services at their annual renewal with their waiver case manager. People will not be allowed to receive housing stabilization services and the following services at the same time: relocation service coordination, assertive community treatment, and moving home Minnesota. Housing stabilization services will not duplicate the services that I will list briefly. If more intensive housing-related services are needed, clients receiving these services should be referred to housing stabilization services. A person can receive the following and the new benefit: ARMS, targeted case management, though not housing consultation; 1915C waiver services, not housing consultation; semi-independent living services, behavioral health homes, and healthcare coordination, for example, through Substance Use Disorder Reform Services, or CCBHC. In addition, when considering housing-related grant programs, adults who are in a grant-funded program and eligible for housing stabilization should be referred to the new service, but may continue to also receive grant-funded services if those services fall outside of those covered by housing stabilization. For example, support with substance use recovery. One of the requirements of home and community-based services is that assessment and planning must be independent and free of conflict from service provision. This is an important federal requirement for these services. Note that providers can always be enrolled to provide both housing consultation and housing transition sustaining services, but they cannot be provided to the same person if the provider does not have an exception in place. There will be an exception process to the conflict of interest requirement. These exceptions are only for providers in certain geographic areas or for providers that specialize in serving a particular cultural group or non-English speakers. There will be a process to submit an exception request if you as the provider feel you meet one of these categories. It is important to note that due to COVID-19, the conflict of interest requirement is waived through the duration of the public health emergency. However, providers should be prepared to come into compliance with this requirement as the waiver ends at the conclusion of the public health emergency. On July 24, 2020, the federal government renewed the federal public health emergency with regards to COVID-19. Public health emergencies must be renewed every 90 days, so now the federal public health emergency is scheduled to end in October of 2020. So to discuss some planning tips and resources, we would really encourage all of our partners and stakeholders across the state to think creatively about how to integrate housing stabilization services into existing services that are available. So one idea includes combining the new service with Minnesota Supplemental Aid Housing Assistance, or MSA Housing Assistance. MSA Housing Assistance increased July 1, 2020 to $392 a month. And eligibility is now expanded to people who are on or eligible for SSI relocating to the community from a housing support setting. Please see DHS Bulletin number 20-48-04 for more information. Also, because housing stabilization services does not cover room or board or any of those types of needs, pairing the new service with housing support, formerly known as group residential housing, may be a good combination in your community. We would also really encourage our stakeholders to consider ways to maximize housing stabilization services and integrate it into your community. So some of those ideas include recruiting counties and tribes to provide housing consultation services for people not receiving MA-funded case management. This does two things. First, it helps to create more access to the services for people who don't have an MA-funded case manager. And it also frees up community-based providers to offer housing transition and sustaining services. We'd also encourage you to consider ways housing stabilization services can help fund parts of the coordinated entry system. For instance, how can housing transition services support assessors and different components of that system? And finally, think about how housing stabilization services can cover services paid for through state grant dollars and how to target those grant dollars towards services not covered by medical assistance. The next two slides cover additional resources that are available to you as you learn more about housing stabilization services. We have a variety of websites that are helpful as you're exploring the service. So the first is the Housing Stabilization Services policy page, and we do have a mailing list sign up where you can get important announcements. In addition, we have the MHCP Provider Manual, which was discussed earlier while reviewing provider enrollment. And then also the MHCP Provider Directory is where you will find an up-to-date list of all enrolled providers in our services. Please search under Home and Community-Based Services as the type, and then select the subtype of Housing Stabilization Services. In addition, as located on our policy page, we do have a frequently asked questions document that we update every month and post, which includes a collection of questions that we've received from the previous month that we try to answer with some more detail. We also have webinars that are available for you to review, including a general overview that's recorded and located on the Housing Benefits 101 Partners page, as well as a PDF version on the policy page. Finally, we do have targeted case management webinars that are recorded, and we will be posting, if not to our policy page, hopefully to another resource in the near future, which includes mental health, vulnerable adult or developmental disability targeted case management, and child welfare targeted case management for youth in transition between the ages of 18 and 21. Finally, we really like to encourage the use of Housing Benefits 101. This is a wonderful resource that has a variety of tools to not only help people that are being served, but the professionals who are supporting them. It includes a variety of different paths to think about what is needed to meet one's housing goals. And that includes benefit lookup, budgeting pathways, and general information about housing stabilization services, including a brochure and a visual aid that was just published. Housing Benefits 101 also offers a vault feature, which allows for free secure document storage and transmission. So this would be a wonderful feature to use if the person you're working with is concerned that they may lose physical documentation. Setting someone up with a vault account and putting that documentation there, such as the proof of disabling condition or the professional statement of need, is a great way to keep tabs on that documentation. And then there's new pro tools, including Keeping My Housing Plan to guide the work of housing sustaining providers. We also recently published a person-served workflow, or DHS 7347, available on eDocs to help people understand through a visual means how somebody would walk through getting enrolled onto these services. And finally, we encourage everyone to reach out to the Housing Stabilization Services team anytime via email at dhshousingstabilization@state.mn.us. This concludes the Regional Roadshow for providers. We want to thank you for your time and participation in learning and listening about housing stabilization services today. Thank you.